who's actually covered under Medicaid? I'm Jill Horner. This is Comcast Newsmakers. With me this hour is Roger Baumgarten. He is the Director of Media Relations for the Hospital and Health System Association of Pennsylvania. Thanks for being with us.
Thanks.
First of all, let's talk a little bit about your organization. Who do you actually represent?
We represent approximately 250 healthcare providers across the state, primarily acute care hospitals. That's your hospitals with emergency departments and the like.
Now, let's talk a little bit about the Medicaid system. Who's actually covered under Medicaid? Who uses this program in Pennsylvania?
Well, there's a misperception, I think, that Medicaid covers people who won't work, for example, when in fact Medicaid covers people primarily who cannot work, and that would be the children, the elderly, and people with disabilities.
So let's talk a little bit about some of the challenges that come along with Medicaid and funding for Medicaid. How is Medicaid funded? What does Medicaid funding mean for hospitals?
Well, Medicaid funding is a combination of state and federal funds. What it means to hospitals is it's significant. Medicaid covers, for example, 50% of the births in this state. The challenge that hospitals have in this state is that Medicaid historically has only paid 77 cents for every dollar of costs that hospitals spent on Medicaid patients. That underfunding obviously puts hospitals in a very difficult financial situation.
Put that in context of what that means for a hospital moving forward and overall cost for a hospital.
Well, when a hospital has a significant percentage of its population being covered by Medicaid, every Medicaid patient being covered and treated in that hospital is essentially a money loser for the hospital. So it is important that those Medicaid payments be at an adequate level so that hospitals can continue to keep their doors open.
How important are hospitals in the overall economy for Pennsylvania?
Hospitals are an enormous part of the state's economy. They contribute nearly $100 billion a year to the state's economy, and they also provide almost 600,000 jobs.
Now, there have been proposed cuts in the budget process for this year in Pennsylvania, more than $300 million in reductions in terms of Medicaid payments in the state portion for Medicaid payments. What could that potentially mean for the hospitals that you represent?
Well, for hospitals, it could mean either service reductions, could mean staff reductions, and it could mean closures, potentially. Most importantly, it's the impact on patients that we care about. That could lead to patients having to wait longer for care or perhaps having to travel further for that care.
So let's talk a little bit about some of the things that could potentially be done in order to offset those costs. If those costs actually do go forward in this, these cuts rather, do go forward in this budget process, can hospitals work to modernize this Medicaid payment system in order to better offset these potential reductions?
Well, it remains to be seen. In fact, we did something about it last year. Hospitals recognizing that Medicaid underpaid and also recognizing that the state had a budget problem, came forward, volunteered to tax themselves, and also contributed $246 million to the state's general fund to assist with the state's budget gap. In return, hospitals got a more consistent payment system and an increased payment. This budget proposal, both the governor's plan as well as the House plan that we've seen, threaten to essentially undo the gains from that modernization plan.
Are there additional steps, though, that hospitals could take to further modernize the way in which this payment system works?
Well, hospitals are always looking to modernize and improve what they're doing. They're looking to deliver care as efficiently as possible, serve the most people at the lowest cost. Hospitals in Pennsylvania have done an exceptional job of that over the years in being extremely efficient in the delivery of their care. But at some point, when those reimbursements get too low, they'll have tough decisions to make about services and staffing.
And we just have a few seconds left, but is that the concern that you're hearing from your membership for your organization?
Our members are very concerned about this budget proposal. It could lead them into a situation where they'll have to make very difficult decisions about the services they may continue or cut.
All right, thank you very much.
Thank you.
We've been talking with Roger Baumgartner. He is the Director of Media Relations for the Hospital and Health System Association of Pennsylvania. I'm Jill Horner.